want to say huge congratulations to everyone involved in the vaccination program, because it looks tremendous. It really does. And I know what a massive difference it's going to make to everyone. This isn't just something that happens really easily and everyone has access to it in terms of around the world. This is because we have a world leading NHS. This is because we have the right people, the right research and development here. I think there's a big UK story here to tell, isn't there? Helen, maybe I could turn to you and just ask you about what it's like in North Wales. Obviously, I remember that being up at Anglesey a long time ago. I know the area you work in very well and very fond of the area. But how are you coping? How are the sort of resources and support network working up there for you?
Yeah, I mean, it's different across North Wales. I mean, we've got, three sort of distinct geographical areas. So the east, being nearer to England, is harder hit currently than the west, and areas like Anglesey. So we can learn from our colleagues in the east.
Darlene, turning to you, I gather you've been vaccinating for about 30 years or so you're well versed in what vaccinations are all about. But like you said at the beginning, it's mostly predominantly been schools you've done it in. Tell me about the change and the challenge from adapting to what you're doing now.
We've just adapted. So I've 3 weeks ago, thankfully, my school immunisation team, the school stopped. So I used that as an opportunity to embrace them. They've came on board with me. They've done fabulous work. For me, the most important thing is us vaccinating the patient, and the nurses going in and vaccinating the patient is the end product of lots of planning and lots of partnership working. I'll tell you, there's been tears and there's been lumps in the throat, but there's been laughter as well over the last 3 weeks. It's been such a lovely experience.
Yeah, it's nice to have that light at the end of the tunnel for everyone, I think, isn't it? It feels like it's been a very long year. Yeah. Well done, Darlene. It's fantastic, and you're doing a brilliant job up in Ayrshire. Jake, if I can turn to you.
My role is purely just to so basically flow management, just so everyone gets into the hospital safely as possible. Gotcha. And feel safe and comfortable, and just try to make the experience for them is relaxed and not so tense during these times, really.
Brilliant. And what are some of the people you're talking to when they're waiting for the vaccines? What are they saying to you? What are their worries?
What vaccine they would be getting is quite a worry. And just how long the process takes, really. But generally, a lot of people were just happy to be there and glad that they're getting the vaccine.
Well, I think if I was going to have vaccination, having you talk to me would calm me down. So you're obviously doing a good job of assuring and relaxing everyone as they come in.
Thank you.
Good stuff. And Brona, sorry, last but not least, obviously you're a key part of the distribution and supply, I take it.
As everybody said, I know I'm going to repeat myself. People have moved mountains. They've just moved mountains day in, day out. I've been down in the mass vaccination centre, so I suppose I went from ordering to seeing it put in someone's arm, because the pharmacist has to be there. The enthusiasm, the vibe that let's get this done, we're really making a difference. It's really, really palpable, and it's just lovely to be involved.
My grandparents have had the vaccine, and I'm very proud of them for doing that. So it's really important that everyone gets their vaccine when they're told to. So thank you so much. I've got to let you guys go because I know how busy you are. Thank you so much for chatting to me. I really appreciate it. And just a huge congratulations to all of you for playing your part in such a monumental moment, frankly, to roll out this vaccine. I think it's a hugely proud moment for the NHS and for the UK being able to achieve such a massive task. And good luck to all of you, and look after yourselves in the process.